But it turns out now that we're doing studies where we look at pre-operative mental health and post-operative outcomes, we now know that it is more important than the skill of the surgeon. It's more important than the weight of the patient. It's more important than whether they smoke or not. It's more important than if they were taking narcotics or not. Mindset is key to your functional and pain outcomes of any given procedure, which means also, and this is shown in many studies too, that it is important for before you have surgery. So the people with the better mindsets, quote unquote, or the ones with the mindsets that inhibit pain, promote exercise, give a positive attitude, and decrease stress mentally, those people tend to not have as much pain and have better function, better performance, better work, better sleep, everything. Wait, we went back to diet? Okay. The evidence. What is the evidence of mindset? Optimism is shown with 30% lower pain catastrophizing. So what is pain catastrophizing? These are the people that say, my pain is never going to get better. This pain is the worst pain ever. This pain is ruining my life. There is no future for me except for this pain. So everything is catastrophic in their thinking about pain. 30% of that drops in optimists. So just training your brain to be more optimistic reduces pain catastrophizing, which means you have better outcomes from any given treatment. And 20% less actual pain. So not only are you thinking about it less catastrophically, but you actually have less pain. Why? Because the brain has a capacity to amplify or turn down pain signals. So you can go to 11 or you can go to 1, and your brain controls all of that. Active coping is really another mental or mental health or mindset paradigm that really helps. So avoiding things does not help your pain and certainly never improves function. I've told you that we're part of the problem. Many doctors have told people and still tell people to avoid activity. Probably the worst thing you can do. Actively coping and actively facing the problem and dealing with it, 20% reduction in pain. Functional MRIs of optimists have been done. These are MRI studies where they look at certain brain centers to see what turns on and what turns off in the face of certain stimuli. Optimistic people, so people that test high on optimism scale in certain surveys, have more activation in the anterior cingulate cortex and the prefrontal cortex. What does that mean? Those are the parts of the brain that control pain perception. So the functional MRIs prove that people that are optimists have better ability to turn down their pain signals. So this is a busy slide too, and all I'm going to tell you here, this is a big, massive database study that was done with machine learning using Bayesian statistics, which looks at conditional and changing probabilities. What they looked at was the actual pain and perceived pain felt by people in the face of certain stimuli. And they found that if your bias is good, meaning that your expectation is that you can handle the pain, it's not going to be much pain, it's no biggie, in the setting of a certain stimuli that is expected to give this much actual pain, you will have this much. So if you think that you're going to have less pain, you will have less pain. That's what this study showed, and the opposite was true. So if you thought you would have that much pain, or worse, you thought that it would get worse with the stimuli, that is exactly what was going to happen. And they matched this to control groups as well. So this is what I'm talking about.